Okay, I think Christelle is ready. Are you ready?
Yes, if you can hear me and you can see my slide, it's okay.
I can see it and I can hear you.
Perfect. So thanks for your waiting and your attention. So I will present you this article entitled Higher Sodium Channel Excitability in Cardiac Purkinje Cells. This paper, can I turn? Okay, like that. So this paper was written by the team of Yigang Li and published in the JCC. Can you see my mouse?
Yeah, we see it.
Perfect. So it was published in the JCC Clinical Electrophysiology with as an impact factor of 7. Oh, yes. Yes. So briefly, I will introduce the topic. So MEPPC is for multiple ectopile Purkinje-related premature contraction. It's a disease caused by the mutation inside the voltage-sensitive domain of the NaV1.5 channel. It's a very conserved domain where a mutation appears in the arginine residue and change to a tryptophan residue and induce ectopies inside Purkinje fibers that can lead to premature ventricular contraction. So briefly, the NaV1.5 channel is a sodium channel. It's a voltage-sensitive channel that allows an inward sodium current inside the cytosol that you can see here. It's the ENA peak, and this current is responsible for the depolarization phase of the action potential. There is another type of sodium current called the ENA for sodium current late, and this current can modulate the duration of the action potential. The NaV1.5 channel is also modulated by two subunits called beta-1 and beta-3. Purkinje fibers are part of the ventricular conduction system. So as you can see here on this cartoon, they are represented in red. And this arborization allows a faster conduction of the electrical signal from the sinus node to the myocardium. Nevertheless, they are poorly studied due to their low representation inside the heart and the difficulty to isolate them. Nevertheless, some teams have success, to isolate them and characterize their electrophysiological properties. So, such as our team succeed to isolate the left ventricular cardiomyocyte and Purkinje cells from sheep. And you can see here the action potential in red from left ventricular myocytes and in red from a Purkinje cell. So as you can see, the action potential duration is longer in Purkinje cells than left ventricular cardiomyocytes. And this longer duration can allow the formation of abnormal electrical activity called EAD for early after depolarization, or DAD, delayed after depolarization. These two abnormal electrical activity can also lead to the formation of ventricular tachycardia and ventricular fibrillation. Okay, in a previous article, the same author characterized an increase of higher late sodium currents inside Purkinje cells versus left ventricular myocytes from rabbits. And this higher sodium lane current, as I already mentioned before, can modulate the duration of the action potential and can be a cause of the longer action potential observed here and the sensitivity to arrhythmogenic events. So first of all, this paper is based on a clinical case that I will present you. So the patient is a woman age of 29. She was referred at the hospital for palpitation for 2 years, but she received no treatment before hospitalization, and she mentioned at arrival that her mother suffered of a sudden death at the age of 32. So clinician realized a 12 lead ECG and the Holter recording of the patient with a transthoracic echography and a genetic testing. At the end, the patient received amiodarone. So for the ECG, you can see with blue arrows, frequent premature ventricular contraction, also named PVCs, inside the ECG of the patient, and the Holter recording detects a high frequency of PVC between 27 to 70 per day, with a high load between 30 to 61% of the total number of beats, and also a paroxysmal atrial fibrillation. However, the transthoracic echography show only a slightly enlarged left ventricle with normal ejection fraction and normal coronary arteries. The genetic testing revealed a mutation inside the SCN5A gene. It's the gene coding for the NaV1.5 channel. And this mutation occurs inside the exon 16 in the D2S4 domain. This is the voltage sensor domain. And the mutation involves at position 2440 a switch from C to T, and that's contribute to the modification of the amino acid residue. So as we can see on this 3D representation, the normal amino acid arginine is switched on tryptophan. And as you also can see, this switch disturbs the structure of the domain. So at the end, the patient receives amiodarone. So it's a class 1, 2, 3, and 4 antiarrhythmic. So it can inhibit the sodium, the calcium, and the potassium currents, plus it's a beta blocker. And at the end, on the ECG, no one PVC were recording. And at the end, the frequency decrease during the Holter recording. So all these parameters suggest that the biophysical properties of the sodium current and the subunit composition of the sodium channel are different between the Purkinje cells and ventricular cardiomyocytes. And all of that contributes to the predominant role of Purkinje fiber in ME-PPC syndrome. So the goal of the investigation was to understand the cellular and the molecular mechanism underlying the ME-PPC phenotypes that is exclusively expressed inside Purkinje fiber, and explore the effective treatments of this syndrome with the R840W variants. So first of all, the team isolate ventricular myocyte and Purkinje fiber from mongrel dog, and they characterize, the electrical characteristic, and more precisely, the sodium current from these two groups of cells. So first of all, you can see here the representative currents of ventricular myocyte, and here from Purkinje cells. And you have here plots of the sodium density curve from ventricular myocyte and Purkinje cells. And as you can see, the current density from Purkinje cells are higher than ventricular myocytes. Next, they characterize the inactivation and the activation parameters. So inactivation, represented here, is the transition between the closed state to the inactivated states, and the activation, represented here, is the transition between the closed states to the open states. So as you can see in blue, there is a left shift toward hyperpolarized potential of activation and inactivation parameters of Purkinje cells, and that's lead to a larger reduced current, represented here in blue. At the end, they also characterize the recovery. It's the transition between inactivated state to closed states, and they observe that Purkinje cells have a slower recovery kinetics than ventricular cardiomyocytes. So all these parameters contribute to a naturally higher sodium channel excitability inside Purkinje cells. So in a second time, they want to characterize the mRNA expression and the membrane protein expression inside these two groups. So they isolate Purkinje cells and ventricular myocytes in order to realize pure RT-PCR with cybergreens, and they characterize the expression of SCN5A and SCN1B to 4B, and then normalize the expression with the 18S gene. For the protein parts, they characterize by Western blot the expression of the NaV1.5 channel and the 4 subunits beta-1 to beta-4. And they use a troponin T as control. For the mRNA expression, they observe a similar expression of the SCN5A gene between all the category of right or left ventricular myocytes or right or left Purkinje fiber. But they also noticed a higher expression of SCN1B and N3FTB inside Purkinje fiber compared to ventricular myocytes. So the conclusion. And for the protein parts, the blot that you can see here, and the different histograms that normalized the protein expression, confirm that even if the sodium channel is similarly expressed between both group of cells, the expression of two subunits, NaV-beta1 and NaV-beta3, are higher in Purkinje fiber than ventricular myocytes. In order to understand the impact of these two subunits on the channel function, they realize cell transcription inside CHO cells with 3 plasmids, one coding for the SCN5A gene and another one coding for the SCN1B and 3B, so the gene coding for the 2 subunit beta-1 and beta-3, and the last one with the GFP in order to recognize transfected cells. And as they do for the ventricular myocyte and the Purkinje cell, they characterize the sodium current by patch lab. So you can see here the representative currents of the NaV1.5 channel alone, and here cells co-expressing the channel and the 2 subunits beta-1 and beta-3. So the current density show a higher I will just switch my words. The current density of cells co-expressive the channel and the 2 subunits is higher than cells expressing only the channel. And as we have seen before, left inactivation curve and inactivation curve and activation curve are also left shift toward hyperpolarized potential that lead to the higher Windows current observed before and lead to a larger normalized ramp current that you can see here in green. Finally, the recovery kinetic is also slower, and all these parameters confirm that CHO cell co-expressive, the NaV1.5 channel and the 2 subunit beta-1 and beta-3 share similar biophysical properties with Purkinje cells. So in order to characterize the impact of the mutant channel, they continue the transfection cell with this time a plasmid coding for the SCN5, the wild type gene, the wild type channel, or the mutant, the variant channel, the R840W. With an and with SCN1B and 3B protein and GFP another time for recognize transfected cell. They also do a patch clamp characterization. So I will begin by the mutant channel first. So as you can see here, it's compared to the wild type channel, and there is no or few modification of the current density, as you can see here. But when they focus on the inactivation and the activation parameters, they found no modification of the inactivation kinetics, but they they noticed a left shift toward hyperpolarized potential of the mutant channel, and that leads this shift contributes to, how can I say that? The left shift of the activation curve contributes to the quicker activation of mutant channel compared to wild-type channel. And this shift contributes also to a larger Windows currents and an even larger RAM currents. So as a conclusion, the mutant channel, the R814W, causes a gain of function of the channel producing a cell hyperexcitability and the MEPPC syndrome. So now we focus on the co-expression of the two subunits NaV-beta1 and NaV-beta3 with the variant channel. And as you can see here on the current density curve, the co-expression of the variant channel and the two subunits increase the current density. Inside the group of cells co-expressing the variant channel and the two subunits, there is a left shift of the inactivation parameters and a left shift of the activation curve that causes an even larger reduced current and an even larger RAM current. So as a conclusion, Purkinje cells are more susceptible to MEPPC associated with these variants of NaV1.5 because of their higher expression of beta1 and beta3 subunits. Because of the effective treatment of the amiodarone of the patient, the team focused on the effect of this drug on the variant channel. So they realized the same characterization by patch clamp. And as I said before, amiodarone is a sodium inhibitor. So when they applied amiodarone on CHO cell co-expressing the variant channel and the two subunits, they observed a decrease of the current density. Alors, I precise that there is a mistake between colors. So here, the current density in presence of amiodarone is in green. So as you can see, there is a left shift of the inactivation curve toward hyperpolarized potential, and that's led to the reduction of the reduced currents represented here in green, and the reduced redundant currents, be careful, represented here in pink. And at the end, they observed that the recovery kinetics is by 2 times slower compared to the group without amiodarone. So at the end, amiodarone reduced the gain of function of the NaV1.5 variants. And that's why it's effective on the patient. So some other mutation on the voltage sensor domain has already been characterized, and they generate a gating pore current. So what is it? The gating pore current, it's a current observed at high voltage applied after the reversal voltage. So as you can see, this is the representative current of cell transfective with only the wild-type channel. Here, the wild-type channel plus the two subunits beta1 and beta3. So this is a Purkinje cells mimic, how can I say, presentation and behavior. Here, the transfection of the variant channel alone, and the last one, the representative current of a group of cell transfected with both the variant channel and beta1 and beta3 subunits. So gating currents, pore currents are plotted here in function of the voltage, and here at specific voltage at 40 millivolts. So as you can see, for the wild-type channel with or without beta1 and beta3 subunits, there is only a linear leak current. And this is normal, it's physiologic, but the variant channel causes an even larger outward gating currents. And when we add the two subunits beta1 and beta3, this current increases even more. And as you can see, at 40 millivolts. So as a conclusion, the R840W variant induces a gating power current like the overmutation observed inside the voltage transfer domain of NaV1.5 channel. And the co-expression of the two subunits beta 1 and beta 3 exacerbates the gating power current. So for discussion...
Would you mind explaining the gating pore current a bit more? Because
yes.
I think in that linear part of the IV curve, what you essentially see is the, it's the reversal potential, of course, but then there's no current at all. And I understand that you see, if you take the plus 40 millivolt value, that you have an inward current, because it's below the... but what does it mean? I mean, the slope of that part of the IV curve is a measure of the resistance of the channel.
Yes.
So what does this tell you?
Is that there is an even larger leak in presence of the variant channel, because here normally the sodium come inward the cell, and at the reversal voltage there is an outward current from the cytosol to the extracellular parts. And if the leak is very reduced in presence of a wild type channel, the variant channel, because it's modified on the voltage transfer domain, it cannot even more regulate this leak, and the leak increase and gets this type of current.
And they suggest that this is arrhythmogenic, correct?
Yeah, totally.
Yep.
So in the discussion, they only recapitulate all the novel findings that they present in their article. So first of all, that Purkinje cells have a more negative voltage dependence of the sodium activation and inactivation parameters, and an overall larger windows current than ventricular myocyte, suggesting so a naturally higher sodium channel excitability inside Purkinje cells. So second one, the higher expression of the two subunits NaV beta 1 and NaV beta 3 subunits in Purkinje cell contributes to a distinctive biophysical property of the sodium current between Purkinje cells and ventricular myocytes. And at the end, the R840W variants induce an outward gating power current, and the expression of NaV beta 1 and NaV beta 3 has a deep effect on the biophysical properties of the channel, causing a larger left shift of the activation curve toward hyperpolarized potential, an even larger windows current, and an exacerbated gating power current. So at the end, Purkinje fibers have a higher susceptibility to the R840W variants and a susceptibility to MEPPC. And for prospective limitation, they only mention that they cannot do the characterization of a variant inside Purkinje cells. So for me, they defend the utilization of CHO cell. I can understand this part because I know that it's very difficult to isolate Purkinje cells, and I think they cannot find a way to maintain these cells in culture to elicit transfection. But as you maybe have you seen on my slides, the current density in CHO cells and in Purkinje are very different. I will put here the value. And I think it's due to the proportion of plasmid that they put inside the cell. We cannot control that. So I think it's for the difference become from these parts. I also notice a low N of cell inside each figure. And for me, the utilization of CHO cells contribute to a lack of Purkinje cell cellular environments. If a ligand can act on the sodium channel, and it has already been described in the literature that the sodium channel is a protein extremely regulated by the environment. And I think we can lose some elements of the regulation. So for prospects, I suggest to use rats or rabbits with the mutation. I know it's a costly and long process, but it can permit to recording action potential and to know how the modification of the sodium parameters can act on the action potential and first of all on the depolarization phase. So thanks for your attention, and if you have questions, don't hesitate.
Thank you very much. So that was a very complex paper. So for the discussion, maybe you can go back to the summary, the graphical summary that gives a nice overview.
Did you want the diapositive?
Yeah,
the
why
slide?
not? Yeah.
Okay.
So do you think that the window current is important for arrhythmias, or do you think that the increased sodium current is responsible for the arrhythmogenesis?
I think first of all, that's the increase gain of function of a channel come from the left shift of the activation curve.
Yeah.
The gating per currents, yes, can act, but more like the late sodium currents by increasing the duration of the action potential. But I don't make any experiments and on this type of current. So I think we have to see on the action potential to be sure.
Yes. Because what is essentially missing is the measurement of EADs or DADs.
Yeah, I'm agree.
Yeah. One remark about the window current, it's not a new concept, it's a very old concept.
Yes.
But if you look at the size of it, you know, it looks larger, but you have to multiply the fractions in order to get to the, I'm sure it's bigger, but still the amplitude of the window current is very, very low. It's very difficult to explain any extra inward current for it. And what is more, this is a IV curve, so it's describing the voltage dependence of the activation and inactivation.
Yes.
But in reality, there is a time dependence as well. So to get the window current, you have to clamp the cell at -70. You know, that is in the upstroke, it's not very reasonable to be there because it immediately goes to the sodium reversal potential. And in the repolarization, you don't stop at 70 millivolts, -70 millivolts, to maintain the window current. So I'm a bit hesitating about the relevance of this for arrhythmogenesis, to be honest.
I think it's just a proof of concept and just a sodium characterization of why Purkinje are a preferential arrhythmogenic inside this pathology than ventricular myocytes. It's purely fundamental analysis. It's detached from the context of the cardiac cells and the cardiac tissue. So I think, okay, it's a base, but we have to increase the complexity of the model to be sure that it's the cause of the disease.
Yeah, I agree with you. Jason, have you ever tried to increase the window current in Purkinje cells?
No, I mean, that's the missing part for me here is, does this actually lead to anything interesting like an EAD? I mean, it's just showing some changes, but yeah, we could model that and look at some things if we knew some open channel probability. Because we do stochastic models. If we know the open channel probability with respect to voltage and time, we can build these models to replicate what we would see rather than determining it, which would be cool. But another question I had related to this in the very end, you mentioned using rabbits or mice. And I'm not really familiar with this, but is there evidence that the sodium channels are different in the myocardium with respect to the Purkinje? Like, are the isoforms different between the species, or is it pretty well preserved, or do we not know?
In this article, they use dogs and after short cell, but in a previous paper that I mentioned in the introduction, yes, they use rabbits. And I'm not paying attention to the isoform of the NAV channel in rabbits. Maybe they mentioned that in the limitation of their study, but a lot of paper on Purkinje cells use rabbit because of its simpler animal model to isolate these cells. In larger animal, it's a bit more complex.
Because in humans, I don't know if we can get fresh tissues at all, or even do this study in humans. Is it possible?
I found one paper on the characterization of Purkinje cells with human cells, and it was from patients suffered of cardiomyopathies, and it was, how can I say, very like this paper, a proof of concept, because we are in a pathologic tissue with a cell that's suffered of also remodeling. And they describe the modification of, yeah, I think it was heart failure or dilated cardiomyopathy. So the consequence of the pathology on the electrophysiology of these cells. I can find the paper if you want.
That's fine. I mean, just another thing for me, I think this is me being kind of naive in the sense, like, that means there's different stimulus thresholds. If the window current is shift, correct, to different voltages, that means you should stimulate the Purkinje first before you would the myocardium?
You mentioned how they can realize this figure?
Well,
I don't understand the
so
question.
what I'm trying to understand is if I'm stimulating from a very low voltage. I mean, I'm thinking of it in a different context of EADs.
Okay.
But I'm just trying to understand how I could stimulate the Purkinje network and not the myocardium. Is it possible to use a much lower threshold stimulus and capture, since this window current is shifted, like capture the myocardium first or the Purkinje? Is this possible?
So, there is two things. One first is, do you want to realize this analysis on tissue or in cells? Or
basically in tissue. I mean,
in tissue.
Intact.
Okay, so
I want to see a propagating beat. Yes.
Okay, so if you want to stimulate Purkinje fiber, at the end you will stimulate also the ventricular if you are in the tissue. It's a basis. But if you because the window current we can characterize this with patch lamp. I don't know if we can do that on microelectrodes. I'm not sure, no.
I think what Jason means is that if you look at the figure with the window currents, then you would be able to pace the red cell with a larger window current with less current intensity than the blue one or green one. Is that what you mean?
Yes, exactly.
I can tell you. Yeah. Sorry, go ahead.
But the problem is that you have to do this as minus 70 millivolt when the action potential is recovering, and the sodium channels have not regained excitability yet. So you can't stimulate at that point.
Gotcha.
Guido, you had something to...
No, it's just, I mean, I was going to answer Jason that in vivo, it's going to be relatively impossible.
Yeah.
Just to say, like, if you wanted to test it in vivo, I'm not sure if we would find a junction. And if we don't have a needle electrode, we could try this, but it's purely speculative.
Yeah, I think so.
kind of where I'm going with all of that. I mean, it was
Yeah, yes,
this is
yeah.
interesting. These are single cells, but you start connecting them to the myocardium and together through Purkinje muscle junctions. And how far up the Purkinje is this actually relevant, right? So where would these EADs even occur within an intact Purkinje network? And I'm not so sure it's that obvious. You know, you can talk. We haven't even established that this even generates an EAD, let alone
No.
where in a network would it actually happen is a whole nother question. So I'm not sold. Basically, where I'm going is there's a lot of groundwork that has to be still made.
Okay. Any more comments?
No. I'm more tolerant towards the CHO the experiments. I mean, it's a model. It does its
Yeah.
job quite nicely.
Yes.
It's relatively elegant with this all these transfections.
Yes.
I am sold on the model.
No, it's a very reliable model if you want to describe the biophysical properties of any channel or changes in them because of mutations.
You mentioned, Christelle, that this mutation is conserved among species, or is the composition of the voltage sensing subunit?
Yes, the composition of these parts of the channel is very conserved between species, and that's why the modification can provoke that problem. It has. I put a figure of one paper that I found. It characterizes a lot of. I think this one. It characterizes so in 3D the modification of this domain, and I think was the same or not. Yes, in the same, they propose this graph, this cartoon with this part, which is an highly conserved part.
And I asked this question to Christelle, to Ruben, but I am intrigued by what Jason asked. Like in, for example, in these animals with menopause, we find a lot of free-running Purkinje. Would we, for example, pace one of these free-running fiber and see, maybe answer Jason's question, or is it completely naive? Please, excuse me, it's a stupid question. It's not really.
For me, it can be very difficult to see the importance of the Windows current inside the wall tissue, because it's not only the sodium, you have other channels.
No, I'm talking about just excitability. You're just
oh yes, you can.
Pacing threshold.
Yes, you can.
Yeah. Is that something you have, Jason, as an information, or is it something that you're interested in?
I'm interested. I don't have that data.
When the next animal is out, feel free to pace from there.
Yeah.
But I'm a little bit interested of what you have mentioned, Guido. So you say that in ovectomins sheep, there is more Purkinje fibers?
What we saw in the few animals that we have is that the network of free-running Purkinje seems to be larger.
Okay, because I've used also a sheep model, and we see that it's very large heterogeneity between the individual, a part of the age of whatever.
Yes. This is what also Nestor told us. So we're waiting for more evidence, of course. But these animals are quite old, and we assume that this surgery gives them a little bit of a boost in not natural aging, because this is not natural for them. So
okay.
This is what Melez is interested mainly in understanding if there is more Purkinje muscle junctions or changes in the network structure and one day excitability.
Okay. I'm interested about these results.
Yeah, this will be in Olivier's hand.
Okay.
The left ventricles. So.
Yeah, about excitability, the title mentions sodium channel excitability.
Mm.
This is a kind of a misconception because a channel can be open or closed, but it cannot be excited. The cell is excited or can be
Yeah.
hyper. So it's a bad title. But excitability is related usually to the ease with which you can depolarize the cell from its resting membrane potential. That's excitability, and for that you need the injection of current, of course. That's how you pace, but it's defined by the IK1 current that holds the membrane potential stable. So excitability is not something I would think of in terms of sodium channel, except when the sodium channel is blocked, then excitability goes down. But that's almost, that is obvious. But it is mainly the strength of IK1 that determines the inexcitability of the cell. And therefore the loss of IK1 is contributing to increased excitability. I think excitability is the wrong concept here.
Yeah, it can. I think they choose this title for the hyperpolarized inactivation of the activation curve. So the mutant channel gets activated quicker, or the part of the population of the sodium channel there is more can get activated by the same pace.
Voltage. Yes.
Yeah.
Yeah, it's not quicker. There's more current at the same voltage.
Yeah. Totally.
Yeah,
But
it's clinical electrophysiology. Probably it's a more digestible title.
Yes, that's probably the reason. Yeah. Okay.
It's very nice paper. Very nice
Yeah, thank
discussion.
you very much for your efforts.
Mhm.
So is there in July, there's no journal club, I expect?
I think we're seeing each other in September, no?
Yeah.
Yes, the next one is October the 14th.
Oh, that's a
So
long
far.
way.
Okay.
Okay.
It's my turn to find a speaker, unless we have somebody already volunteering. Severin, I don't know.
For the moment, no.
No.
But-
Okay. I will hunt someone down.
Okay.
Volunteer.
Something
Oh, I have Luis. Perfect. There's no problem. I already found it.
Okay, thank you very much. Well,
Thank you.
Christelle, thank you for the presentation, and the others.
Thanks
for
a lot.
Oh, thank you very much.
interesting. Bye-bye.
Thank you.
Take care.
Bye. Have a nice day.
Same to you.
Bye.